Let's talk about it. Have you ever had one of those moments where you accidentally bump your head and wonder what just happened inside your skull? It's a common experience, but there's more to it than meets the eye. We all bump our heads sometimes. Whether it's hitting a low door frame or a playful knock while having fun, these incidents are part of our daily lives. It's a part of life, right? We laugh it off, maybe rub the sore spot, and move on. But have you ever paused to think about what actually happens inside your head when you experience that bump? Your brain, a delicate and vital organ, is cushioned by cerebrospinal fluid and encased in a hard, protective shell. Your skull, don't worry, it's not as scary as it sounds. Most of the time, these bumps are harmless. However, sometimes they can lead to something more serious. Today, we're going to talk about something called a subdural hematoma. Sounds complicated? It might, but it's important to understand what it is and how it can affect you. Don't worry, I'm going to break it down for you in a way that's easy to understand. A subdural hematoma occurs when blood collects between the dura mater and the brain, usually due to a head injury. Think of your brain like a delicate fruit protected by a hard shell, your skull. When you bump your head, the impact can cause blood vessels to tear, leading to bleeding in this space. A subdural hematoma is like a bruise that can happen between this shell and the surface of your brain. This collection of blood can put pressure on the brain, which can be dangerous if not treated promptly. We'll dive deeper into this in a bit. But the important thing is that knowledge is power. Understanding what a subdural hematoma is and recognizing the symptoms can make a significant difference in how you respond to a head injury. The more you know, the better equipped you are to take care of yourself and your loved ones. Symptoms can include headaches, confusion, dizziness, and even changes in behavior. If you notice any of these signs after a head injury, it's crucial to seek medical attention. This isn't about overwhelming you with medical jargon. It's about empowering you with the knowledge to make informed decisions about your health. It's about giving you the tools to understand a common health concern. By knowing what to look for and when to seek help, you can take proactive steps to ensure your well-being. So, let's demystify subdural hematomas together and learn how to stay healthy. Remember, your health is in your hands, and understanding these conditions is the first step towards taking control. Imagine your brain is like a walnut, carefully nestled inside its shell. The walnut represents your brain. The shell is your skull, providing that tough protection our brains need. It's designed to shield the brain from external impacts and injuries. Now, between the skull and the brain itself, there are layers of tissue called meninges. These meninges consist of 3 layers: the dura mater, arachnoid mater, and pia mater. They act like a cushion, helping to keep the brain safe. These layers provide additional protection by absorbing shocks and preventing the brain from moving too much within the skull. A subdural hematoma happens when blood collects in the space between one of these layers, the dura, and the brain surface. This can occur due to a head injury, which causes blood vessels to rupture. It's like a tiny pool of blood forming in that space. And depending on its size and location, it can press on the brain. This pressure can disrupt normal brain function and lead to various symptoms. This pressure is what can cause problems, potentially affecting how the brain works. Symptoms can range from headaches and confusion to more severe issues like seizures or loss of consciousness. Don't worry, we'll get into the specifics of what those problems can be. It's important to understand that the severity of a subdural hematoma can vary greatly. But for now, just remember that location and size are key factors here. The larger the hematoma and the more critical its location, the more significant the impact on brain function can be. Early detection and treatment are crucial in managing this condition effectively. So, what causes this pool of blood to form near the brain? Let's delve into the various factors that can lead to a subdural hematoma. Well, the most common culprit is head trauma. This can happen in many different ways and can affect anyone, regardless of age or health. Think bumps, falls, or any kind of impact to the head. Everyday accidents, like slipping in the shower or falling downstairs, can result in significant head injuries. These impacts can cause blood vessels in the brain to tear, leading to bleeding. The bleeding then accumulates, forming a subdural hematoma. But it's not always about a big dramatic injury. Even seemingly minor incidents can have serious consequences. Sometimes even a minor head injury can cause a subdural hematoma, especially in older adults. This is because their brains are more vulnerable. As we age, our brains naturally shrink a little. And this can make the blood vessels more fragile and prone to tearing. This shrinkage increases the space between the brain and the skull, making the vessels more susceptible to injury. Certain medical conditions like blood clotting disorders or the use of blood thinners can also increase the risk. These conditions affect the body's ability to stop bleeding, making even minor injuries potentially dangerous. It's important to remember that everyone's different. Factors like age, overall health, and medical history all play a role in how a person might be affected by a head injury. What might cause a serious issue for one person might be less of a concern for another. Personalized treatment and careful monitoring are key to managing the risks associated with subdural hematomas. Preventive measures such as wearing helmets, using seat belts, and making homes safer for the elderly can significantly reduce the risk of head injuries. Always consult with healthcare professionals to understand your specific risks and how to mitigate them. Understanding the causes and risk factors of subdural hematomas is crucial for prevention and effective treatment. Stay informed and proactive about your health to minimize the chances of such injuries. Spotting the signs. Symptoms you should know. Now, let's talk about what to watch out for. Subdural hematomas don't always show symptoms right away, and that's why it's important to be aware of the possibilities. Think of it like a spectrum. On one end, you might have mild symptoms like a persistent headache, feeling dizzy, or having some confusion. As the pressure on the brain increases, the symptoms can become more severe. You might experience nausea, vomiting, slurred speech, or even seizures. Sometimes these symptoms can develop gradually over days or even weeks after a head injury. That's why it's crucial to pay attention to your body and any unusual changes you notice, especially after a bump on the head. Getting a diagnosis. What to expect at the doctor's. If you suspect a subdural hematoma, the first and most important step is to see a doctor immediately. They will ask about your medical history, any recent head injuries, and the symptoms you're experiencing. To confirm the diagnosis, doctors use imaging tests, most commonly a CT scan. Think of it like a powerful X-ray that takes detailed pictures of your brain, allowing doctors to see if there's any bleeding or pressure. An MRI scan might also be used. This test uses magnets and radio waves to create images of the brain, providing even more detailed information about the hematoma. It's like having a high-definition map of your brain, helping doctors determine the best course of treatment. If you suspect a subdural hematoma, the first and most important step is to see a doctor immediately.